Luckily, y'all don't have to hear me talk a lot, but we're mainly going to hear from Jennifer, who has started the Alpha Gal Encouragers group. So you're going to get to hear her story, and their group also focuses a lot on education, so that's going to be a big component of what they do. And so we'll talk a little bit about the pharmacy side and kind of our role as we've learned about Alpha Gal over this past year. Just to kind of get started, whenever I'm learning about a new disease state or a new issue, I like to put a patient face with it. Helps me remember things, helps me connect it to the real reason we're actually doing what we're doing. Because at the end of the day, we can learn a lot of information, but it's about serving the patient and taking care of them. So our patient is Michael. He's an Eagle Scout, avid outdoorsman, Air Force, 2 deployments to Afghanistan. You know, a guy's a guy, right? And was diagnosed with alpha gal. So there's no level of, oh, I'm in really good shape, so I don't get alpha gal. It's not like that. And we're gonna learn more about it. But I'm just doing the introduction. I'm gonna turn it over to Jennifer. Eric and Jennifer Burton moved to Northwest Arkansas July 2004 and live on a little over 2 acres and surrounded by woods near Beaver Lake. Jennifer loves to garden, cook, loves to camp. They have chickens, 2 dogs, and 2 cats. She never really worried about tick bites since, for those who like the outdoors, ticks are just kind of a known nuisance. 2011, Jennifer began experiencing increasingly worsening allergic reactions that went undiagnosed or misdiagnosed. Following a 4th and nearly fatal anaphylactic reaction in February 2017, Jennifer was finally properly diagnosed with alpha gal syndrome in April of 2017. Eric has also been recently diagnosed in May 2024 after developing allergic reactions following a surgery. Actually had the reaction to the sutures that they were using in the surgery and the adhesives afterwards. In June 2017, with Eric's support, Jennifer started the Alpha Gal Encouragers, which started as a Facebook group. That quickly grew, and then in November 2019, the group became the Alpha Gal Encouragers, which is a nonprofit support group focused on support and advocacy and education. Their mission is threefold: to encourage, empower, and educate. Over the past 7+ years, the Burtons have stayed up to date with current alpha gal syndrome information in an effort to educate others. During that time, they have made important contacts with various alpha gal researchers and experts, along with Arkansas State Health Department officials and federal legislators. Currently, they are focusing on a bill that's been introduced in the House, HR 9382, so you'll hear a little bit more about that during the presentation, which is the Alpha Gal Allergen Inclusion Act. Legislation recently introduced that would classify alpha gal as a major food allergen under the Food, Drug, and Cosmetic Act. I'll turn it over to Jennifer.
Okay, first I always like to ask, how many of you have been bitten by a tick? Right, just about all of you. How many of you have heard about alpha gal and kind of have an understanding about alpha gal before this was announced, this presentation? Okay, great, quite a few of you. So hopefully I'm not giving you too much new information. That's not that.
That's where it needs to be.
There we go, okay. A little bit about the encouragers. We have 2 facets in the encouragers. The Alpha Gal Encouragers Northwest Arkansas is our Facebook support group. We currently have nearly 3,000 people in Northwest Arkansas. About half of those 3,000 are from the Northwest Arkansas region, and then others come from around the surrounding area. The Alpha Gal Encouragers is the nonprofit support and advocacy group. We serve Arkansas. We serve more of a region: Arkansas, Missouri, and Oklahoma. And our mission is to pretty much not just the patient, but for education. So our goal is to promote compassion, encouragement, health, and understanding. And our threefold mission is to encourage, empower, and educate. And that's not just the person who got alpha gal, but their families and our doctors, our nurses, people like you that can help us. One reason we want to bring this to your attention is we want you to understand some of the things you may not understand on how to diagnose us and how to treat us, because there's really no cure. It's, there's no cure, so the only thing we can do is prevention. So don't get bit, don't get sick. If you put your sunglasses on and your sunscreen on when you go out, put your insect repellent on. So you've already answered that question. And what's the definition of alpha-gal syndrome? Hopefully you are pretty well advanced with this. Alpha-gal syndrome, also known as the mammal meat allergy, or some people call it the red meat allergy. I've crossed that out because we don't like calling it the red meat allergy, because pork isn't red meat, and so people think they can eat pork. We get that question all the time. It's life-threatening. We actually know people who have died. It's a tick vector acquired allergy. It's not a natural allergy. It's to the protein link sugar, galactose alpha-1,3 galactose, which is different than all other allergies. This is the carbohydrate, this is the sugar, all the other allergies, we're allergic to the proteins. It's found, alpha-gal is found in mammals other than humans and primates. And that causes an increase in, for some reason, it causes an increase in our alpha-gal antibodies and a release in histamines to the point where the person, after they ingest mammal meat, will have some sort of an allergic reaction. Not every time, but it can build up and it can be kind of like a Russian roulette. Sometimes, every time, sometimes worse than other times. And it's not always just ingesting mammal meats, it's also the byproducts. The difference between alpha-gal sensitized, there is a difference between being alpha-gal sensitized and being clinically diagnosed. And the difference is, there are a lot of us that test positive, but we don't have any kind of allergic reactions. We don't quite know why that is, but there are a lot of us that do test positive. But we're not sensitized to the point where we have developed allergic reactions. So the clinical diagnosis of alpha-gal syndrome is you have to have both. You have to have a positive blood test and you have to have symptoms. One of the hardest things about diagnosing this is we're not like a protein allergy, like a peanut allergy. You eat a peanut, for people who have peanut allergies, and maybe in the first 5-10 minutes they start having an allergic reaction. Our allergic reactions are delayed between 3 to 8 hours. Mine are typically 6 hours from the time I eat mammal. You can almost set your watch to it. If I make it past 7 hours, I'm golden. If I don't, and I know I'm in trouble. So that's another reason why it's very hard to diagnose this, because you may have clients that come to you and they say, oh, well, you know, I woke up at 2 in the morning, 1 in the morning, and I was covered in hives, or I was throwing up, or I was just writhing with GI pain. So that's, you know, part of the reactions. Currently, we know that there's only 2 vectors that have actually been proven research-wise, scientifically, that cause someone to develop alpha-gal syndrome. That's the Lone Star tick and the black-legged deer tick. They carry it in their saliva, so all they have to do is bite you. You may not even know you've been bitten. It may be like a mosquito bite. You may have kind of brushed something off and it bit you, it left a mark, and you think it's a mosquito bite. A lot of us don't remember being bitten by a tick. If you've read or heard, CDC says, oh, they have to be attached 24, 48 hours, 72 hours. That's not the case with alpha-gal. All they have to do is bite you because it's in their saliva and it's not a bacterial or viral infection. Whatever it is that changes us to become allergic to mammal meats, it's in their saliva, so it's just a bite. Also, if the adult female carries it, she can lay 5,000 to 8,000 eggs. And every one of those larvae, then when they hatch, will have alpha-gal. The old saying was, well, they had to bite something and then bite a human. That's not the case. That's been proven by research. So, chiggers, you'll hear chiggers. I heard somebody say chiggers. Okay, you'll hear chiggers. Research, according to entomologists that we've talked to, entomologists say there's actually no proof, no research that's proven that they carry alpha-gal. In the US, chiggers aren't known. There aren't other countries, but in the US, chiggers aren't known to carry any kind of pathogens. Since research has proven that the larva, the newly hatched larva, can carry and transmit alpha-gal, now researchers believe that they think people have oh yeah, I got bitten by chiggers, they actually got bitten by the larva. And a couple of reasons for that. One, they both have 6 legs. The tick larva has 6 legs. And they're also microscopic, so they're very hard to see. This is an example. Now I know there are people that get paid to count ticks under a magnifying glass. These are tick larvae that have been a larva bomb, as I've quoted it. Those are under a microscope. That's how small the larvae are. So they're very easily mistaken as chiggers. In this article from 2006, it's even by experts. They thought they were treating this patient for chiggers, and they started digging the little guys out of the bumps. And when they got them out to the lab, and the lab came back, they were tick larvae. This man suffered over 250 bites for brushing into a larva nest. This mom said that her son had 400 to 500 nips attached to his body. They had to shave his head, and because they were in his scalp, it took them 9 to 10 hours to remove them. One of my coworkers did the same thing. They brushed into a nest, and she said, she's very fair-skinned and redhead. She said she could see her freckles moving, but she couldn't see anything. She ran in the house, stripped off all her clothes, threw them on the floor, big no, and took a shower, scrubbed herself, and she had over 100 bites when she quit counting, across her midriff and her arm. 6 weeks later, she had alpha. So, kind of give you an idea, this is one of my husband's coworkers. This is in his backyard. Where does he live?
Elkins. He has 20 acres on Elkins.
20 acres on Elkins, and he was clearing some brush in his backyard.
You can't see it, but there's a patch in his boot. That's what crawled up his leg and started to do the running. So as it hit, then they started to spread. So the top one was the first, then the second one at the knee, and then below. Well, he has it.
And he has it now. I asked him where his lint roller was, because we advise people who hike, take a lint roller, that they crawl up you like this. You got a lint roller, you take them off really quickly. They hunt in packs. They stay in bunches. So you'll see, and here's an example of a female laying her eggs. You'll often see entire neighborhoods and families, multiple people in the families, will have alpha-gal symptoms and be alpha-gal positive. It's not contagious, but you have to remember, they've probably hiked together, they've lived in the same area, they do the same things together, so it's very possible they're all
Close piles aren't the same, as you suggested, don't you?
A quick question. You had said before it took 6 weeks later she had alpha-gal. Is that usually about the time?
Average is about 4 to 12 weeks, but some people do have reactions within 7 to 10 days, and others are longer. Good question. Lone Star ticks are very aggressive. They actually smell us, and they smell the CO2, and they can sense us, and they will come running for half of the football field. And CO2 can be from a fire, it can be from dry ice.
Campfires just bring them out. So you're sitting there enjoying your campfire, and you're sucking them suckers.
Okay, and unlike other ticks quest, so they'll crawl up, they'll separate after they hatch, and they'll crawl up on a leaf, and they'll just kind of hang out there waiting for something to walk by and they grab on. That's not the case with alpha-gal. And it's not the case with Lone Stars.
Is that a running video, honey? Is that the
Yeah.
video?
You'll have to.
You can just click.
Can I click on it? Oh, you have it set to click. Okay, so here's an example. See everything moving? And he's gonna pan over. We don't know why he stopped here.
You know he's on the bike trail here in London.
But you can see, and it's kind of mesmerizing when you're on a computer screen and you see it full up on a computer screen, because you can identify the majority of these as being females with the white dot on their back. The males do not have a white dot, so don't think just because it doesn't have a white dot that you're safe.
The male has it around his body.
Yeah, he has white splashes around his body. There'll be a handout over there that you can take. Okay, where in the world is alpha-gal? It's actually found on every continent except the Antarctica. Okay, but it's not the same tick. So it's in Australia, it's in Europe, it's in Asia. In Australia, it's a paralysis tick, and in Asia, it's that Asian longhorn tick. Asian longhorn tick has been identified. It is here in the US. It has been found in Arkansas and Missouri, close to home. So far, there has not been any reported cases from Asian longhorn tick, but we do know that it is active with Rocky Mountain spotted fever, Heartland, and velociviruses. Also note that if your patient has been diagnosed with alpha-gal, or if you're diagnosing them with alpha-gal, it's very possible, because the Lone Star tick also can carry ehrlichiosis, tuberemia, Lyme, star-eye, rickettsias such as Rocky Mountain spotted fever, tick paralysis. Besides alpha-gal, your patient may be diagnosed with 2 or 3 things, or need to be diagnosed with 2 or 3 things. If they've stopped eating mammal and they're not having reactions anymore, then maybe they need to have a tick panel done to find out whether they have ehrlichiosis. Is very common in this area, and so is Rocky Mountain spotted fever. Where in the US is alpha-gal? If you've picked up the maps, you've probably already seen this. It's found basically, it used to be found basically from the Mississippi east, south from the coast into Canada. But now it's found just past the Mississippi River. And the 13 states that have been identified as having the highest prevalence, Arkansas is number 1. Oklahoma, then Missouri, Oklahoma, and Arkansas kind of dance around together as far as who's first. Unfortunately, Arkansas stays first. Kansas, Kentucky, and Mississippi are the top 6, and the rest of those, as you see, are in the lineup. So there's our map. CDC put this map out with a report in July of 2023, based on what they know and where they've found the cases. They suspect that 450,000, almost 500,000 of us have it, but don't know. So far, there's been about 110 to 150,000 of us actually diagnosed. As you can see, we're the hotspot in Missouri. This is kind of a scary one. This is from the military. This is a report from the military. They took blood tests from the recruits, and of the recruits, and these percentages don't add up to 100, just so you understand. Of the 100% of people that were tested in Arkansas, 39% tested positive for alpha-gal. And the real scary thing is 47% of those, that was actually northwestern Arkansas. Next again is Oklahoma and Missouri and Kansas, top 4.
Is that 39%, is that military recruits with symptoms of alpha-gal?
That I don't know. They were taking random blood tests that they do when they go in, and they just took random blood tests and added alpha-gal. As far as the reactions, I don't know. The entire study is over on the table if you want to take a look at it.
Another question on that same line. So if they're not having reaction to alpha-gal, but it's in their system, right? The blood test is positive. Can it show up in other ways other than the symptoms of alpha-gal?
That I couldn't answer because the symptoms are so varied, which we'll get into. One of the things about identifying alpha-gal syndrome is really understanding what anaphylaxis is. Anaphylaxis for most people think anaphylaxis is anaphylactic shock where our throat, you have hives and your throat closes. But that's not anaphylaxis. Anaphylaxis is all encompassing every system of our body. So anaphylaxis is considered potentially fatal allergic reaction where it needs medical attention, and it attacks our immune system to the point where it's a full body reaction. So any of these symptoms, abdominal pain, nausea, vomiting, diarrhea, slurred speech, confusion, a lot of us have brain fog, wheezing, coughing, sneezing, hives, rash, low blood pressure, heart racing, palpitations, arrhythmias. One of my worst was arrhythmias. My heart rate would go up to 150 to 160 beats a minute, and I ended up having to have heart surgery over it after about a year and a half. So these are all things that are very possible reactions. 20% of us have, there's some sub categories of us, I guess you would call them, where only about 20% of the patients of us report that they have GI symptoms only. You may have a client or a patient that just complains of GI issues, constant GI pain, constant diarrhea, just not feeling right. It could be alpha-gal. Not everyone has a skin reaction. According to FAIR, when we're supposed to use an EpiPen, most of us are that are highly reactive, which I am, are issued EpiPens. And if it's one of any of the main bodily systems, we're supposed, and it's major, we're supposed to use our Epi and go to an ER. Reason why you need to go to the ER if you use your Epi, if your patient says, oh, can't I just use my Epi and stay home? It really affects our heart. What epinephrine does to us and raises, and the other thing is, within 10 to 15 minutes, we can rebound and need a second Epi or need a second. I carry 6 because I'm 40 minutes away from the hospital where I live. So I hit myself the first time, and I either have someone take me to the hospital if my husband's home, or if I call 911, I know I have to have enough to get me through in case I rebound.
About in 16 minutes for an ambulance to get to us.
Yeah, it took about 12 when you went down, so. So what are the typical symptoms of alpha-gal syndrome? There are none. There's no typical symptoms. That's the problem. So what we recommend for our patients, our newbies, is to keep a personal journal, a food and reaction journal. And the food, what you ate, what you drank, what supplements you took, everything you put in your mouth and you ingest.
The day and the time and how you felt.
Okay. And then throughout the day, if all of a sudden you get a massive headache, record it and the time. All of a sudden you get a really bad stomach ache, record it and the time. Because our reactions are delayed, or you start itching. You might not have hives, but you start itching. And a lot of mine, all of a sudden my coworkers would go, what's the matter with your neck? Because my hives would start here, or they would start here and flare. So the symptoms are all over the place. So this was a study that was done of 2,000 patients in 22, actually it started in 21, and in 22 they did the numbers. 88% of us have skin reactions, 81% of us GI reactions, respiratory, cardiovascular, emotional. You'll find one of the handouts over there that lists them all. Also lists some of the other nuances that were recorded at the time. So as you can see, they kind of go all over the place. Diagnosing alpha-gal is real simple. It's simply a blood test. It's that simple.
The right.
Well, the right blood test, yeah. And it's an alpha-gal test. So these are the test codes, if it's Quest or LabCorp. If you're able to request codes, a request test. A couple of the others that we recommend, or you might wanna recommend, is the total IgE and dairy. 50 to 60% of us react to dairy, whether it's whey protein, and that's one of whey protein. Everyone has a protein shake. Yeah, no. And then this is the diagnostic code that you can use for an insurance. This is our best information. alphagalinformation.org. Over 100 of us put this website together. It's managed by the person who spearheaded the project. And it's got everything from Alpha-Gal 101 to patients who have recommended certain doctors to research information, research documents. So this is a really important website and tool for you. Is it only mammal meat? No, it's not. At least it's not for me. I'm even fume reactive. If my neighbors are barbecuing a steak or brisket, they usually call me and tell me so I can close all the windows and go inside, because my throat and my lungs, I'll start wheezing and coughing and I'll start having asthma reactions. Of course, I've been bitten many times, and the more often you're bitten, the worse it gets. So I think the longest I've gone between bites is about 1.5 years, and I get bitten again. So. But the normal ones you're kind of used to are beef, pork, and dairy. Gelatin capsules, that's where we get down to the meds and the medications. Supplements. If you're recommending supplements to your clients and they have alpha-gal, they're gonna react to them. Chances are they're gonna react to them. Gelatin capsules, as I got worse and worse, started sticking in my throat. My throat started getting so swollen that several times I went in and they just looked at my throat and they said, oh, you've got strep throat, and they diagnosed me with strep throat. But I had to stop taking my supplements because I couldn't swallow them anymore. And then I got to feeling better and I started my supplements again, and the whole thing just kept circling around until I was diagnosed with alpha-gal. And then I realized it was the gelatin capsules in my supplements. So watch your gelatin capsules with your supplements. Prescription medications, another big one. Lamb venison. Vaccines. It says 13% because this is, again, from this study of 2,000 patients where they've recognized they've had symptoms. A couple of the things that we've noted is that they may not have had surgery, they may not have had any dental work done, so those numbers could have been higher if they had. We recently had a woman who had oral surgery done, and the doctor vetted everything and it's supposed to be okay, and the next day the whole right side of her face was swollen. And they went back and they went through everything again to figure out what it was. Turns out that synthetic dissolvable sutures actually had mammal in them, and that she was reacting to that. Had someone else who had sinus surgery done, and her entire face was swollen, and they went in and same thing. The synthetic sutures they had used had mammal in them, and she was reacting to them. They had to do a second surgery to take out the sutures. So, 2 years later, 2.5 years later, we're finding out that these numbers are actually higher. For example, report to medications, prescription medications, and you'll find this handout, this quick tax handout. Be sure you pick up one of these because these are more current. The over-the-counter meds that were reported here and the prescription meds, 36 reported here, 75% of AG patients now report having a reaction to medications with alpha-gal in them, and 50% of those report having alpha-gal anaphylactic reactions. And that's from Vegan Men, which they've partnered with. Okay, you had something
So
to add?
about people who have heart surgeries have to put big valves in, what happens to them when they get out?
Okay, I'll address that, and then we're gonna go on, and then we'll take all the rest of the questions after. people who have had heart surgery and had pig valves, or, they're on medications for, anti-rejection. Those medications could be bothering them, they get alpha-gal later on, the medications could be bothering them, but we have noted some cases where those valves start to deteriorate, and within 6 months to a year, they need to have a mechanical valve. So that's also something to be stuck in the back of your mind. Okay, okay, yeah, one question, and then I'm gonna turn, okay, go ahead. You're up. I heard you're up. You'll have to take that. Left click. Or you can let him know. There we go.
So I'm Corrie. I work here at Debbie's as I'm a technician, and my job is to do compounding. But now I'm running the alpha-gal program for our store and representing our area and our state, and by default, I think we're representing our nation for pharmacy. So we're in the very beginning stages of trying to help pharmacy staff figure out how to manage these patients that are having these type of reactions. So Andrew and I have started a program, and then now we're adding people to our team to help with this. So Stephen and Madeline and our other pharmacists. But what this means is patients will come to us oftentimes. Physician may send them to us, so either the Tina Merritt, we work a lot with her office, she'll send people who they've managed the medication or the food part, they're starting to address health and beauty items that they have, and then she sends them, okay, we need to address medication because they're still reacting. But now that is expanding, people are starting to learn that we have an option here to help patients research their medications. So I have people all the time reaching out to ask questions about that, come in, and I'll go through our over-the-counter section. But we do offer a med check, alpha-gal med check. So if it's a couple of meds, you know, that's fairly easy for us to either, it's already in our database that we researched, or we can research it fairly quickly. If they have multiple meds, we ask that they schedule a med check with us so that they have undivided time that we can sit down with them, and then a lot of that is the research that's done once they go home. So we work very closely with Vegan Med, so veganmed.org will work with patient, hospital, physician, pharmacy, anyone who needs help with a medication, whether it is alpha-gal or any other allergy. They will help research medication, and I've had them research beauty products for people, supplements, OTC items, but we use them all the time for prescription meds. So that is a free resource for anyone. As of now, it is free. So we have set up a lot of manual checks in our system. So when a patient comes to, a script is sent over, and on there it will say that they have alpha-gal. Immediately stops are put into the system, because the pharmacy system doesn't have any way to, you can select that the patient has alpha-gal allergy, but there is nothing stopping us from actually filling a medication, because the inactive ingredients that they're having the reactions to, that doesn't pop up in our computer system to alert anybody. So the same thing is happening when they go to the ER. Same thing is happening when they go to their PCP. The doctor says it's fine. The doctor has no idea what brand is being dispensed, what manufacturer is being dispensed when they come pick up their medicine here. So we have to take responsibility for that. We have to know they have it. Then we put in manual checks into our system, and that prevents everyone else from working on it, except for the handful of us that have been trained to do it. So it starts with the researching of the medication. Once we find some brands that would be safe, so not all levothyroxine is okay. There are certain brands that are okay. Same thing with diphenhydramine. So Benadryl brand name is not okay. There's only a few that are okay for diphenhydramine. So that's where we can help the patient, you as physicians, or whatever your your area of expertise is. So we then look and see, do we have access to the brand that is safe, that is free from lactose, and magnesium stearate is a big one for tablets. So that can be plant or mammal. It has to be researched. It does not say on there, it doesn't tell us it's plant derived or not. So that's one of the issues, and Andrew will go into the legislative part that we're working on. But once we find a safe brand, we then, if we're able to order that, get that in for the patient, help them. If that is not an option for commercial drugs, then we look at compounding. So I have the capabilities to compound something that would be vegetable-based capsule that has been checked through Vegan Med, because sometimes carrageenan is used, and if you're familiar with that, that can cause a reaction, even though that is a plant-derived, that's red algae. So that can cause a reaction like a mammal product. So we avoid all carrageenan. And then we use a filler that is safe. So we have the active ingredient, the filler, and the vegetable-based capsule. Sometimes that's not an option. Either I don't have access to the powder, or it's not financially an option for the patient. And then we will work with the physician to find a different medication. And sometimes that takes several rounds of that. Once we've got the medication that's safe, it goes to our pharmacist to be final checked. We have these special stickers that are on there that we created just for it stands out for us, for the pharmacist, and for our patient. So we train all of our patients when they first come in. If they receive something from us and they don't have the pink sticker, that they need to stop and ask, I need to just double check this, because we are human and that could get missed. It is all very manual. So that's just a safety check for them and for us. And then we also have the over-the-counter things. So this started as one little section, and now it has expanded to this whole side, and then we have other products down the store, so they all have the pink sticker. We also encourage the patient that they should let us know that they have alpha-gal when they're buying something, because we need to double check that, and we don't want them to accidentally pick up something that they think is okay and it's not. So I'm trying to think about other than we are willing to work with any pharmacy staff. It does not have to be our pharmacy. We love our patients, but we can't take care of all of the patients in our area. And plus, we've dealt with people that are in other states. So we have a Facebook group for pharmacy staff that's nationwide or worldwide, I guess. So we can share ideas, learn from them, learn from us. I will help any pharmacy that wants to talk to me about how we do our process. And we'll work with any physician as far as trying to educate them on our side. If a patient's gonna have surgery, we try to encourage them to find out what the meds are gonna be ahead of time, communicate with us so we can help research that, so they're not dealing with those issues that some of these patients were having, so.
Can I add one thing? You mentioned Benadryl, and I wanna address Benadryl real quickly. The way, when I was having my anaphylaxis reactions prior to my being diagnosed, I was taking Benadryl. The one that was almost fatal for me, the last one that was almost fatal for me, it took nearly 3 days of me taking Benadryl, two Benadryl every 6 hours. It took nearly 72 hours for the hives to finally go away. That's not an allergic reaction, but because my body was still fighting the mammal that was in the Benadryl, it wasn't using the diphenhydramine like it should be. Now that we have the sleep melts that we use that don't have that magnesium stearate, I can take one of those instead of two, because they're 1 for 1, and within 30 to 45 minutes my hives are gone. So it does make a difference. That people might say, I don't react to magnesium stearate, but they may not know it's not necessarily a reaction. It's just you're not using the medication, your body's not using the medication properly.
Anything else that you think of on that?
So we talked about, so all of this we have learned in the last year. When we, is actually, the way we kind of got started with it, we connected with Dr. Tina Merritt, who's an allergist and one of the top 3 in the country. She's here in Bentonville as far as researchers for alpha-gal. And my wife and I were actually out to dinner, and some people we used to go to church with came up to us, and the lady was one of the nurses for Dr. Merritt. And she's like, hey, do you know anything about alpha-gal? A little bit. My background's in compounding, so we would see some patients. She's like, oh, we need to talk, because she's like, all we do is alpha-gal. Okay, so we went and met with them and started learning the scope of what we were dealing with. And it became one of those things we say a lot. Once we were made aware of the issue, like, you can't walk away now. The need is too great. And so we started our talk tonight talking about Michael. And so I want to go back to him. So Michael had alpha-gal, had a reaction, called the ambulance. They came out to his house. He was responsive enough to be able to tell them that he had alpha-gal. Was transported to EMS, stabilized. But one of the things we've seen with alpha-gal is there's a lot of cardiac issues. We have a high percentage of our patients with alpha-gal that have had some type of cardiac event, or AFib is very common. Unfortunately, AFib usually carries after that a blood thinner, and almost every blood thinner is not safe. Eliquis is like the number 1. Can't take Eliquis. They stabilized Michael, but he had AFib, so they were going to put in I believe a port, and part of putting in a port, you have to keep it open. They gave him heparin because they weren't familiar with alpha-gal. Heparin is porcine derived, so it's from pigs, and 30 minutes later he had a heart attack and died. And it's from not being educated. So we heard that, and our job is to educate people. That's when Corrie mentioned we will work with any pharmacy, that is absolutely true. We love our patients, we take care of our patients, the need is bigger than us. We believe the best place a patient can get care is from their local pharmacy. They should be able to form that relationship with that pharmacist, with that pharmacy staff, and be able to feel confident in the care they're going to receive. And so we want to prevent Michael's story. So we asked permission from Michael's brother, and his answer to us was, I don't want this to happen again. Please tell people so we can hopefully prevent this from happening. But as we were kind of researching the presentation, the need for education, it's amazing how great it is. So about 1 in 2 physicians or prescribers have never heard of alpha-gal. Another 1 in 4 have heard of it, but couldn't diagnose it if a patient walked in with it. So you have a patient that, hey, there's something going on, I'm having reactions, I don't know what this is. 3 out of 4 prescribers they go to cannot help them. That's a problem. And that's also in Northwest Arkansas, where, we usually say thank God for Mississippi, in Arkansas, but we're number 1 in this one, so unfortunately we don't get to say that. But that's the reason we're here. And so this has grown for us over the last year. I think it was October, November of last year that we actually started, and it's grown. And I think because there's such a need, and Corrie kind of alluded to, and I feel bad saying almost the attention we've received, but it's just more of a, hey, we want to help, so we're just trying to tell everybody that'll listen. We've done a podcast. We were interviewed by the Washington Post. Super outside of our comfort zone. That is not us. I'm super uncomfortable right now talking in front of a small group. So, but it's one of those things where, again, you can't walk away once you're made aware of the need, because these patients have been ignored for so long. I think the average now, we've actually improved how long it takes to diagnose a patient. We're down from 9 years down to 7 years on average to diagnose a patient when they first start to seek treatment.
In 7 years.
So imagine going to doctor after doctor and they'll tell you, oh, nothing's really wrong. No, it's all in your head. Gaslighting doesn't even get the coverage.
What about the patients that they end up, the doctor takes the gallbladder out, the doctor takes spleen out, the doctor does.
Well, there's so many unnecessary procedures that occur because they're looking for something. You know, you're having this as symptom. You know, hey, let's take out your gallbladder. You know, those are extra. You don't need that anyway. So take out the gallbladder. Oh, still having reactions. So obviously that went. And so, I mean, even just the cost of the medical system. I mean, if we want to go down that road, so many unnecessary costs just because of lack of education, lack of understanding of what's going on. So.
And we're misdiagnosed with a lot of different diseases. Fibromyalgia because of our joint pain, RA because of our joint pain. Like he said, gallbladders, they've had gallbladders taken out, nothing's happened. So we've been misdiagnosed for up to when I was diagnosed 7 years ago, it was 9 years. In 7 years, they brought it down to 7 years in order, on average, for us to be diagnosed.
Some have been recommended to go see a psychiatrist because the doctors have said.
Because the doctor doesn't know
We
what's
can't help
going
you, you need to see a psychiatrist.
Following the gaslighting, as he said.
So what can you do? You being here, you've now been told. The responsibility is now on you. We're now aware. So your attendance here today is the first step. You've heard it. You've been aware. Tell somebody else. Tell your friends. Tell the people you work with. Tell your family. We're not asking everyone to be an alpha-gal expert. That's not, you can't be an expert in everything. Everyone has their own specialty. Everyone has their own area that they focus in. Great. But our goal is for any alpha-gal patient to be able to walk into any doctor's office, any pharmacy, mention they have alpha-gal, and them either be able to know what to do, which would be ideal, or at least be able to say, I know enough about that to know that you need to go somewhere else. Go see this person that knows what they're doing with it. And so patients will appreciate that because rather than approaching it from I know everything, I'm the specialist, I'm the whatever, everyone carrying a little bit of humility with, hey, we don't know everything. We are learning. We're learning constantly. And so now the more people we can tell, that's really the only way we're going to get the information out to enough people. Last, support the advocacy. There are actually two bills that have been introduced in the House of Representatives. First one, HR 9382, the Alpha-Gal Allergen Inclusion Act. Basically, this is just modifying the Food, Drug, and Cosmetic Act to list it as a food allergen. We're not even talking about medications yet, but if we can get it listed on food, just simply like we do gluten or soy or something like that. And then HR 7373, the Recognize Alpha-Gal Syndrome Act. This is to basically authorize the CDC to track it and to start studying it more. Basically, all the research into it right now is voluntary. There's about 120 diseases that CDC follows and tracks and has mandatory reporting. We're trying to get alpha-gal added to that list. Again, the first, I think, documented case of alpha-gal was that they were actually diagnosed, I believe it was 2009. So we're not talking about a long time, but there's a whole lot of work to do. And then, again, reaching out to the nonprofits, Alpha-Gal Encouragers, great organization here in Northwest Arkansas, has meetings every other month, second Saturday on even months. Did I get that right?
That's correct.
Nailed it. And so they educate, they talk about recipes because you can only eat chicken and steamed vegetables so much before you're looking for something else. And so they go over recipes, they go over tick prevention, they go over so many different things. And I think probably the most powerful thing is to recognize you're not in it by yourself. It takes a group, it takes a support system. We are the best support system we can be from the pharmacy side, but we're not going to the grocery store with patients to help them identify foods that are safe. And so, patients need a pharmacy, they need a doctor, they need an allergist, a lot of them GI specialists, all these different areas that patients need a team to help care for them. Questions? Yes.
Does this invited human tissue?
I'm sorry?
Does it, is someone like alpha-gal, will they be affected if they sound really bad, but ingest or get like human tissue, like cadaver bone and
Yes. So humans don't
I
carry.
didn't listen to Beijing, okay?
Humans themselves. We're not talking about cannibalism. Stay professional here, people.
Sorry.
No. Humans themselves don't carry alpha-gal. And so humans and some primates, as far as in the mammal side of things. But what other things are being used in those procedures, sutures, anything like that, is usually where the issue is my understanding.
So like micro would be okay versus chromic
I do pharmacy.
I might be able to answer your question, but you need to speak up.
You lost her.
I lost a lot of my hearing with my last anaphylaxis with all the swelling in my face and so.
Vicryl, would that work versus chromic gut, which is animal based?
Okay, the chroma one is the one I've heard of, the other one I've not heard of, so I can't verify.
Yeah, so Vicryl's synthetic, it tends to last longer, but some people do have sensitivity. I carried both, but, so someone with alpha-gal could not have the chromic gut, but they could have the synthetic.
I know they can't have the chroma one,
Right.
that one I know, I've not heard of the other one, so that was
Sometimes
just-
even if it's a synthetic, they'll have a mammal coating that a lot of things go through.
Yeah, right now we're going through, a good example of that is, I've been told that I'm ready to have cataract surgery, and I'm not ready to have cataract surgery after one of our members had cataract surgery, and the next day her eyes were swollen shut, and they had vetted everything, and they swore that everything was safe that they used, and, it turned out that they were told the lens was polycarbonate, but what they didn't know when they went back into the deep dive is heparin coated that polycarbonate lens, and she was reacting to the heparin coating. The coating is there so that the eye doesn't clot, thank you. And so, yeah, we have not found out yet if she's totally lost her vision because of the swelling, or if they had to do surgery or what. So we're delaying mine because I have a deep dive, I have an ophthalmologist doing a deep dive on it. So far, they've not found a lens that's not coated with heparin.
Some of them.
Now
And
you
then
know
this
why
is
we do what we do.
About, from what we have found anecdotally, about 75% of medications that we come in contact with in the pharmacy are not alpha-gal safe. So, lidocaine, I believe a lot of the 1% is safe, 2% is not safe. We had a patient who was getting a compounded pain medication for an intrathecal pain pump, and we knew what the ingredients were. We didn't make it because we don't do sterile. Thank you. But the ingredients, there shouldn't be any reason they should be reacting. Turns out the bag that they were getting the sterile water out of had an animal coating. This is what we're like. This is what we deal with on a daily basis.
Some manufacturers.
And so we had to try to find one that didn't.
Lactated ringers is another one. Lactated ringers itself is safe, but some manufacturers, the bags they use, it has that mammal coating, and we've had reactions to them. So I go in for my heart thing, and it's like no lactated ringers is on my.
There's a resource. It's actually a group, a farming association. I forget what the name of it is that puts, and they're very resourceful people because they have slides that say everything but the moo, and they're talking about how much of the cow they
That's
use.
on the table
It's
over
not
there.
just the beef that you have to do, but there's so many products that are used every single part of the cow, every part of the pig, every part of the sheep, goats, everything. Because, they're used for, everything. So personal care products, hairbrushes, toothbrushes, lotions, these are all the issues.
How many of you use oils for your clients? And candles? Do you burn candles? Okay. Well, oils can carry, man, we have to be super careful with oils.
Lanolin is a biggie because lanolin is from sheep.
Vitamin D is from lanolin.
Vitamin D3, cholecalciferol.
So you can't just go
Can't
now.
afford to use.
We do carry a vegan vitamin 3 that's from algae, not carrageenan. We did have to verify that, when we found out it was from algae. A lichen.
What brand is that?
Pure encapsulations.
All of our stickers are over here for our safe ones.
I have a question going back to the camera.
Yeah.
Mhm.
So, or even the heart, if somebody does not have alpha-gal, and they get like a lens, and then let's say 2 years later they get alpha-gal, are they gonna react to that?
Not to the lens, because the heparin's gonna be, used by the body before that, because it's just a coating to keep it from clotting during, after
During the
the
healing.
surgery.
Okay.
So their body's gonna absorb that, and it's gonna be gone if they get alpha-gal. The issue we're seeing is if it's heart valves, where they've actually had a pig valve put in, and they're on rejection drugs. And so they're living quite well with this, and then suddenly they start having issues. We also know that people who are sensitized without any actual allergy reactions have a higher rate of cardiac, about a 30 to 40% higher rate of cardiac issues with plaque. And so they have more plaque and we have more heart.
And that's some of the reason that we need more research into it, is because we see these things, we don't really have the data behind it. We just have noticed it, like we've said with our alpha-gal patients, we have a really high amount of alpha-gal patients that are being prescribed Eliquis. There's something going on there, but, you know, there needs to be.
And blood thinners are the worst.
There's only 2 options, 3? Well, 3 if you take it out of the capsule and just take what's inside the capsule and don't have
Yeah.
anything in the capsule.
Oh, really? Cause when I was first diagnosed, there was only 1. And I had to take it out of the capsule because the capsule was carrageenan.
Yep, that's one of them.
So,
Yes.
Let's see if you could go back to the slide that showed the tests that you
the test slide, there you go. Take a screenshot. That's also in the handout.
Yep, there's a lot of
That's
excellent
also-
resources on the table.
That's also in this handout, this information handout, those codes.
Do you find that that's typically covered by insurance? Like if I were to run that on a patient, do you
I
know?
would say
or-
it pretty much depends on your insurance.
I think
So far, my Medicare has, cause I'm
Wow.
retired now,
It's about 75.
because it was
It's
ordered.
not very expensive though.
But my previous insurance, when I was working, they would not cover it, and it cost $250 for me.
Okay.
That was Quest.
I think it was Quest, yeah.
I have a question.
Yes.
I have a question that I just want, I don't know there's an answer to it, I just would
I'll
like
tell
to
you if I
hear-
don't know, and I'll look it up if I can.
And I'll just pretend
Okay.
I know.
So, in northwest Arkansas, in Oklahoma, why do some people get bit by a tick and get alpha-gal, and someone else doesn't?
That's a good question, and I can answer it.
Mhm.
Pretty much.
Okay.
We have research that shows, and this is one reason we think my husband, who gets bitten a whole lot more than I have, because he works outdoors
Yeah.
constantly. Type B blood type, for some reason, is more resistant to developing reactions if they're bitten.
Interesting.
Next is type AB, because
Okay.
they have the B factor.
Okay.
A and O, which I'm an A.
Yeah.
A and O are the most likely to develop reactions.
Okay.
If a B or AB get alpha-gal reactions, the reactions are usually more mild than an A or an O.
Okay.
So that's something that some research, there's not a whole lot of research out there, but there, Australia has done some research and Europe has done some research. We have some in-house that has done it in the US too, but not a lot, but we've got several that say it is a factor, so.
Okay, I got one more question,
Yep.
you're doing good here. What is the effect of alcohol on someone who has alpha-gal?
Okay, good question. Alcohol, it depends on the alcohol to begin with. Wine can be filtered through gelatin.
Okay.
Sugar can be Refined sugar can be refined through bone char, leaving traces of bone char. Some people react to sugar. I'm highly reactive. I don't react to bone char, in sugar.
Just smoke.
In water filters, I do, because there's some bone char water filters. Okay, brain fog. Repeat your question.
Well, they said that people, some of the things I read said people that have alpha-gal, it is made worse by alcohol, it is
Okay.
made worse by
Yes,
exercise.
it's
and I don't
a,
understand those.
If you're having a reaction, and that's the way it works, so in other words, you drank alcohol and you missed that there was a dairy product and you're dairy reactive or you're alpha-gal reactive and you missed it, you're having a reaction, alcohol will enhance it, make it worse.
Okay.
Same with exercise, if you're having a reaction, exercise is liable to make it much worse.
Okay,
We also know that
so
alpha-gal.
it's not the alcohol precipitated the
No,
alpha-gal.
the alcohol
Okay.
doesn't cause it unless it has mammal, if it was
Okay.
like the gelatin
Okay,
I think
process.
NSAIDs are in that same category.
yes, they are.
So if you're having a reaction and then have the NSAID,
That's
that
worse.
would make it worse.
Yes.
I always forget that, and people ask, why can't we take NSAIDs? And I always try, I know there's a reason why.
Yeah, we
That's
sell,
so-
we
that's-
sell like alcohol safe NSAIDs.
Just don't take 'em.
But,
Okay.
that's different than when they're having a reaction.
And I have one last question.
That's fine, that's what we're here for.
Vegan men, who finances them? They're great. They're
We still don't know.
Yeah.
No.
I know.
Oh, she knows. I don't know. I'm gonna learn too.
It's basically the guy who owns it. It's out of his pocket. It's how he started it, and now that it's actually growing and going, they,
Do they get grants? They
I
deserve
don't
it.
know about grants, but I do know that they work on donations as well.
Okay.
But
But
he
they're
he
good.
started this out of pocket.
Okay.
He's actually, so it was a pharmacist who started it, in California. He's actually there's two pharmacists for him. He's a professor at one of the pharmacy schools in California, and was presented with a case of a patient, and he's like, it took me days of research to try to find safe medications. He's like, it's gotta get better than this.
Okay.
So that's where it kind of started.
Because they're a great resource.
Oh, they're fantastic.
They are
We started off,
phenomenal.
well, I say we, Corrie does 99.9% of the work. I tell people my role is to say yes to what she needs. And so
Pink
she's,
stickers.
and can I order pink stickers? Yes, you can. That's good. But we started off before we found Vegan Med. Corrie was calling manufacturers because that was the only way. And unfortunately, most medications are manufactured in other countries. So there's time zone issues, there's language barriers, trying to explain what alpha-gal is and why you need this information and how, and then to get them to email it to you is, I mean, it was
Months later.
difficult. Yeah.
Well, even recently, like this week, I've talked to Bausch and Lomb twice, and they didn't know, they had to research it, which was fine, but they did call me back, but I had requested to have it emailed to me, and we don't have any way to do that, so.
They don't
Email,
want it
new
in
technology.
But I mean, at least I was dealing with an American company that I could communicate properly,
Wow.
but I still had to just write the case number down, because we try to document as best we can, so I thought that was odd.
Felt like there's more
You should have
reliability.
picked one of these up, because a lot of these facts are really shocking.
Okay.
What about fireworks?
What about
Fireworks.
Fireworks?
fireworks? Okay, yes, fireworks have mammal in them. Gunpowder has mammal in it, if you're an avid
Shooter.
gun enthusiast. Fireworks have mammal in them, and that's gonna affect people who are airborne reactive like me. I get to go out every 4th of July, I just have to make sure that I'm like up when all the smoke is going the other way. Because otherwise it affects.
I was just trying to point, it really affects so many facets. And you think, oh, I got him covered, and then another chop to the facet. It's just.
So to give you how he was diagnosed real quickly, we think he's been under the radar he has type B blood type, he's been bitten zillions of times, honestly. I've literally picked 24 larvae off of his chest from
I
a
worked
site
for
that, the
Buffalo
site
Mountain,
that he
so-
worked at. But, we think he's kind of been under the radar until he had surgery recently, and it was, laparoscopy, so he had 3 holes, and they all got infected, they all started weeping, all the steri strips had big rashes around them, and I said, "You've got alpha-gal," and he said, "No, I don't, denial." And, fine, prove me wrong, get tested, okay, and he got tested, he's positive. He says, "Well, I eat what you eat." That's why we didn't know, because he eats what I eat. Even when he goes out to lunch with the guys, he doesn't have a burger.
What I eat affects her, so it's easy, so I have safe vegan toothpaste, and I've changed all my shampoos, and I don't wear cologne anymore, and so forth.
So we found out through the sutures, and, the only last thing that we had was his supplements, his daily supplements. And I said, "Well, we need to go through your daily supplements." He goes, "Oh, they're fine." No, we need to, so 4 out of his 5 daily supplements straight up said bovine gelatin capsule. So I said, "Okay, we gotta switch these out." We got them switched out, and here's the one little thing that you don't think about. Every morning for the past good year and a half, he's woken up, and for the first 30 to 45 minutes, he's had horrible, deep coughing, and it's productive. And so for the first 30 or 40 minutes, he's up, I'm listening to this foghorn, and I'm thinking, gosh, you know, and he thinks it's his allergies. Well, it was alpha-gal allergies, because about 3 weeks after he started taking vegan supplements, coughing has stopped.
I have a question. I went to brunch with a friend and her husband, and he's eating his bacon and his thing, and he said, "I had alpha-gal a few years ago and couldn't have meat for 2 years, and now I'm okay." Is that?
That's possible. I'm one of those. My reaction started in 2011. They lasted for about maybe 6-8 months, and they went away.
Wow.
I had hives for about 6 or 8 months. Doctors had no idea why. Idiopathic hives, we can't figure it out. 2013, they came back for about 6 or 8 months.
Worse.
Only the hives were worse, they lasted longer, they itched more, and I had some vomiting issues and some GI issues. 6 or 8 months later, went away. 2016, they came back with a vengeance, and that's when I started having major anaphylactic. Yes, we know that about 10 to 12% of us can go into remission. Think cancer, it's remission. Okay, if we're bitten again, our reactions and our alpha-gal numbers are liable to go up. That's why I'm one of the highly reactive ones. I got lucky twice, but I wasn't properly diagnosed, so I didn't know to avoid additional tick bites.
It's just gardening in the backyard.
Other questions? Yes.
I know there's no cure, but from every, your group and all the feedback, are there certain modalities that help people get into remission, or, help people be able to tolerate a little bit more, or anything in addition besides just strict avoidance that people can do to help?
There are some out of the box, and that's the way I'm gonna put it, because that's the way Dr. Merritt puts it. There are some out of the box procedures and treatments that people with alpha-gal are trying. We have heard anecdotally from some of them that about 50% of the time, you've probably heard of acupuncture. Okay, about 50% of the time at the acupuncture procedure that they're using works, and the problem with that is it is remission, and a lot of people don't understand that. So they go back to their eating beef and eating bacon and whatever, and we have at least one report that's been verified that 10 months later, guy went out and had beef tacos with his family, and a couple hours later had a major anaphylaxis and died. So, you know, if those treatments do somehow put someone into remission, the only thing we can recommend is don't go back to eating beef, or if you do, or, you know, don't go back to eating mammal, but if you do, remember you're in remission and carry your EPIs and be prepared, because you can come out of remission at any time.
Got it.
That's a lot of where research needs to be, because it's relatively new as far as identified. The issue is a lot of it we just don't know. There needs to be research. That's why we need to get the CDC to start getting documentation from all the different states. So Arkansas has passed in Arkansas mandatory reporting, but Virginia, I think, has it now.
Virginia will be the law has passed, and I think it starts in January or February, reporting.
But outside of that, even the other states where it's located that we've identified it, they don't have to report their numbers. And so that's one of the hurdles.
New Jersey is voluntary reporting. And the problem that we have is, like we had mentioned, you have to be diagnosed with alpha-gal, so you have to have both, the clinical plus the blood. So you have to have both. And we're looking into one of the next things, when I actually have some time, is to start questioning Quest, because the last I heard, we were 9 months into mandatory reporting, and Quest hadn't started reporting yet because of a computer glitch. So we've lost at least 9 months worth of data. So that's one of the things the encouragers will be addressing soon.
Yeah, we were at the state health department, during the meeting, and they told us about the mandatory.
They had
They
just
wanted us
passed
to,
the
because
law.
We've been working and we had no idea, so she had created a massive presentation to present to them, the reason why we needed, and
Mandatory
they dumped it
reporting.
on her before she could even do anything.
Yeah, it was
So-
great. We were making a lot of headway, for mandatory reporting in Arkansas until, COVID hit. And then everything, all things came to a stop, and then all eyes went on COVID. So it took about 2 years for us to kind of get the steam rolling again, and, we were prepared to give our presentation to the Arkansas Board of Health and say, we need this to be mandatory.
board was there.
And they said, we just passed that 2 weeks ago. So,
Steve Womack's taking it, on, he's really helped us out, he's doing some stuff for us.
Andrew mentioned the 2 bills. I know one of the bills, I have paperwork over there. If you wanna take a look at the bill, you're welcome to take a copy and, read the bill. And that's the one that we're trying to get passed, that it'll end up on the labels, just like you see, contains milk, contains soy, contains wheat, and it'll say somehow contains mammal, contains alpha-gal somehow. That's the one we're really pushing for at this point. And you can help us with that. You can petition, you know, there's a link